And then my regular doctor wasn't getting the bills paid. It wasn't going to them. So
inevitably they weren't getting paid.
no, yeah. At one time I owed him something like $2,000.
Ridiculous. But hopefully all of this is resolved. It's well on its way to getting resolved.
Mm-hmm.
But again, you have United Healthcare and Anthem both saying, it's not me, it's not me. And you've been paying premiums to United Healthcare for decades.
Oh yes, for 40 years.
40 years.
A 40-year patient.
40,
Right.
close to.
Yeah,
Yeah.
a 40-year member. Like,
Yeah.
who would ever want to be a member of that club?
Right.
You
You've
know?
been victimized by the cartel.
Yes, you have.
Because when I first was injured early in my life, I was 32 years old, and I had a terrible back injury. So, and that was like in about 1984 or 5. So, so then I started, after they classified me as totally disabled, then that's when the United Healthcare kicked in.
Mm-hmm. Wow.
So, and Medicare.
And how long have you been fighting to try to get them to pay?
Oh, I would say now probably close to a year and a half or thereabouts.
And they've told you it's been resolved?
Every time I call, they go, yep, we got this taken care of. So one time I called and they put me in touch with Medicare, and the lady said, it's not a United Healthcare problem, it's a Medicare problem. And I said, well, then take care of it. I said, I don't have the money to pay these bills that you folks are responsible for. Oh, it's all taken care of. We'll get back with you. Never hear a word. And so then the next time I call, I get hold of somebody else. And I always tried to write everything down, but most of the people that I speak to are very hard to understand.
Well, it's offshore,
It's offshore. Exactly.
offshore call centers. And
Chickens in the background.
And,
Yeah.
Yeah, and you can hear the talking
right.
like they're trying to sell a vacation property. You know what I mean?
Right. It's
Just in the background. And
yeah.
so you don't know from one time to the next, and there's no way you can call and get a hold of the same person over and over and over.
No. You got people.
So every
selling-
time it's always it's handed down and gets misconstrued, and information gets mixed up, and so then you have to tell your story all over again.
Well, and it puts you into a state of just anxiety. You
Oh,
got
my
here
goodness.
today and your hands were shaking and you're just like, I don't know what to do.
No, I
and
know.
you pay every month.
All right. And I pay my bills. You know what I mean? I don't have any outstanding bills, because when they come due, I pay them. And so, every time I go to this doctor, they're still not paying your bills. We're probably gonna have to start paying for your visits. I'm not paying for my visits. I have insurance for that. So, oh yeah, it's just a constant battle. I go to bed thinking about this. Not quite so much now, but I did. I went to bed, and the first thing feet hit the floor in the morning, and I'm
worried about
paying.
So
what happens if something major comes? And I
let's
go to the
talk
hospital.
about when you did the get claimable complaint. That seemed to be like the push to get over the hump.
Right.
So tell me about that experience. How was that with that team?
Well, when I went to the doctor and she told me that they're not paying my insurance, that somehow or another that you have Anthem Blue Cross Blue Shield, I said, no, I don't. Because to my knowledge, we did not have it. So, because I left my insurance as it was, and then Kathy, my wife, had her insurance, because I wasn't going to disrupt the Medicare and all that stuff.
Sure.
Because I knew one day that she'd be retiring, and then I'm going to have to go through all this all over again. So I kept telling them that, no, I am not on their insurance. And to my knowledge, I wasn't. And then I finally dug deep enough, spent probably an hour and a half on the telephone to find out, and they did tell me that I was, So I had my wife call her insurance company for verification, and then I felt like an idiot because I was on there, but not to my knowledge.
But were you guys getting charged premiums for both?
It was coming out of my wife's check.
Oh my gosh, did they refund all that?
No.
Well, they should.
Something like $400 a month
What?
for me. Yeah.
They should literally refund all that.
Yeah.
Oh.
So you've been paying for United Healthcare and Anthem, and no one's paying any bills.
Yeah, exactly.
Oh my God.
I think it was right at $400 a month that my wife was paying for me.
Wow.
Which, you know, and then she noticed there was a little difference in her check, you know. But that was the furthest thing from our mind, is that
you were getting screwed.
that we were getting, yes, ma'am.
Okay, so that's another.
We didn't even
And
realize
then we couldn't
that.
even get it taken off. You can't take it off.
What?
Why not?
Because we had to wait until the term come around, or until well, the only reason it got taken off is because my wife retired. Otherwise, it would have still been going on.
Wow, I think there should be a way we should be able to get that back. I
Abs-
really do. They're not paying the bills. How did you get signed up for that?
I don't know. I really don't know. When my wife renewed her insurance, that's the only way that we can figure out how it happened, but she didn't sign anything, you know, to my knowledge or to her knowledge.
Right.
Unless she accidentally checked
Clicked
the wrong
a box or
but,
something, yeah.
you know,
Wow.
but, yeah, and that's been, I would say, really close to 2 years.
$400
A month? That's
Well,
for
up until-
2 years?
Up until the time she retired in January.
so now you
Because
do.
there's a date that you have, you know, when your insurance, you can make a change, you
Right.
know what I'm talking
Well,
about.
right, an event.
An
a
event.
retirement.
Right.
A
Or
move
just to
or
renew
something.
or
Yes,
whatever.
Yes.
Right.
Okay, so when you met with Get Claimable and Warris's team,
Mm-hmm.
like, how did that whole process feel
Oh,
and
very
go for
good,
you?
very good. I felt like I was going to get somewhere. Finally, somebody understood what I was trying to explain to them.
Mm-hmm.
And as I said, every time you talk to somebody, it's a whole different conversation. Everything have to renew everything and redo, and you don't know from Adam who you're talking to,
Right.
or if they're writing things down, if they're not, you know. And I was told, yeah, I've got everything documented here in one conversation, and then the next time I went in, and well, no, we don't have any of that.
We have nothing, right?
Right.
So how long was it between when you did your Get Claimable appeal to when someone from United Healthcare called?
It was a fairly short period of time, probably maybe a month, if that. You know?
Okay.
Yeah.
And so then they said, we've got it, we
We've got it,
understand,
you know,
we're working on
and-
it? What is
yeah.
that like?
We understand you're having an appeal here for, you know, my problem. And I said, yes, ma'am, I do. And I said, I need it taken care of. Well, after that, then I got a phone call from a lady that had a child crying in the background.
Mm-hmm.
And a dog was barking.
Mm-hmm.
And she asked these questions about, she goes, well, I need exact dates on this. I said, do you have my records in front of you? And she says, yes. And I said, then you have my dates.
Mm-hmm.
You know, I said, I can't pull a date up right out of my head. I said,
No.
there's been so much going on.
I don't even know
truthfully,
what I had for breakfast.
right.
So this is the
So
United
that
Healthcare
phone call
person.
happened 3 times. The
Okay.
same lady called me and asked me the same question. On the 3rd call, I said, you have already asked me these questions. And I said, supposedly you're not, the way I see it is you're not documenting what you're asking.
Doing, right.
Yeah. Oh, I have? I said, yes, 3 times. And I knew it was the same lady because the same baby was crying and the same dog was barking.
Oh my gosh. Well, all these people are working from home.
I understand
the Lord
that.
knows what. And it's so, you know.
And my
they've
wife
got-
did too, but it was quiet.
Right. Well, you know, she took her career and her job seriously. You
Yeah.
know, it's really hard to work when you've got goats neighing in the background in
Mhm.
India and babies crying and dogs barking in the
Mhm.
States here. All right. So, as it stands today, they said on the voicemail they left you. Was that the same lady or no?
No, this
No,
was
it's a different
lady.
one. Okay, another one. They said that they think they're going to have this resolved by September 3rd.
That's, yeah.
So why do you think it takes United Healthcare so long to do the right thing?
I think a lot of it is misconstrued information. You know,
Mhm.
that's everything gets handed down and it's not documented correctly, and it's not times are not wrote down. And you know, whenever you talk to 10 or 15 people, you know, it's naturally going to get
It's just chaotic.
yes. And I really don't think that there was an honest person there that knew what they were doing, other than just typing in my information. And I'm not sure that they did all of that. So it's very nerve-wracking. It's depressing, you know. worrisome. I think about it all the time. And until you folks, I come to you guys, and then we had that meeting.
With the Get Claimable
Yeah,
folks.
and that was the only time that I felt in my heart and in my head that I'm finally maybe going to get some relief, because he was very genuine. He was caring. He understood what I was trying to say, you know, and he done a very good job. And it made me, when I walked away, I felt at ease, somewhat. You know, finally maybe I got somebody who's going to take care of me and that understands what I'm trying to tell them. So, and I'm so thankful for them and you guys.
Yeah.
So, I'm as far as long as it's taken so long, I don't really understand why or how. You would almost think that would get moved to the top instead of just shuffled with the papers.
Yeah.
You know?
Well, I feel like United Healthcare now has officially been put on notice that they need to resolve this situation.
Right.
I feel super hopeful that it's going to get resolved, and you have our commitment to partner with you until this is done.
And I appreciate that, and I feel very good about that, because I finally have someone that I can trust and that understands my problem versus someone that just don't care. So, because you understand it, and it's just not me that's out there that's having this problem. You know, I even went so far as thinking about changing insurance companies, but then the long drawn out thing that can see, you know.
Oh, for sure.
You know, I didn't want to take a chance of being without any insurance, you know.
Right.
And to my knowledge, you can't have two insurance companies at the same time, but it seems like it worked like that for me.
Right. Well, you know
You would have thought that Anthem Blue Cross, whenever that come up, would have found out that I had United Healthcare.
Right.
You know, because there's got to be a flag, there's got to be something out there that states, you know, how I'm covered.
Well, you know,
at
the core of insurance companies, let's remember, they do none of the actual work.
Right.
They are data companies.
Right.
Okay? They are collecting data. And they can't even do that right.
Right.
Because you've got Anthem and you've got United Healthcare, and both of them point to each other and say, not it,
Right.
but they're both happy to take your money
Right.
and your premium.
Right.
Like, who would ever want to be a member of this situation,
Cartel.
right?
Mhm.
So what would you want to say to United Healthcare's CEO if you had the opportunity today?
Well, that I think that United Healthcare is run frivolously. There's no organization. There's no people that don't know what they're doing. You know, they're just taking people off the streets that can run a computer, and basically that's it. You know, with no medical background, with probably no insurance background, just
Right.
someone to take what I'm telling them as the truth. And so I think it's run very poorly. I would not recommend United Healthcare to anyone now, where before they were always fairly well, and they always paid my bills and all this, and now it's just, if I thought I could go somewhere else without having all the problems of changing from one insurance company to the next, and I don't know if that would even mess up my Medicare or,
Right.
you know, I don't want to take that chance.
Well, I feel like it's going to get resolved, and we are going to be here with you and partner with you the whole way. So when you get the phone calls, you
That's what
text
I
them
do.
to us.
I send them to her.
Yep.
You know, you can call me any day.
Yep.
Yeah.
You can call us. You can text us. You
Well, I
can
got
send us
that
a carrier.
the other day. Whenever I called you, I got that. We checked the mail. We were gone, and it was like 8 o'clock, and I opened it up, and I thought, man, I need to call Claudia. And I thought, oh hell, it's 8 o'clock at night, you know.
You can call her.
But I wanted to get it documented or taken care of as soon as I could, you know, to get it to the right people.
Mm-hmm.
So
I think you did send me a text.
I did. I texted you, but I didn't call you.
Yeah, no.
Well, you know what? We're our trusted partners as supportive staff to Dr. Bach. Get Claimable is a trusted partner of ours.
Mm-hmm.
you know, patients trust us, patients trust Get Claimable, and they don't trust their damn insurance.
Mhm.
That's the message that I take away from this.
Exactly. And they don't, as you said, and they don't care about their group or their members.
Right.
You know, it's just all about, as long as I get my money, then that's all, you know. And they take, now, I'm not really sure, somewhere probably around $150 or $160 out of my check every month that I could use,
Yes.
you know.
For that $400.
Right.
Yeah.
Well, I think that we have a potential that I'm going to talk to Warris and see if we can't see if Anthem would consider giving you some of those premium dollar back, because they didn't do anything
Wouldn't
with
it be
it.
the employer?
No, not necessarily. Do you have an insurance agent or not?
Me?
Do you? Yeah.
Or did she?
Either one of you guys. Did you
No.
guys? Okay, maybe
No.
we need to give them Patrick's card, because Patrick might be able to help them.
Because whenever she finally called to find out, the nurse or the lady on the other end said,
And it's the
There he
million hour.
is. There he is.
Wow.
We were just
Gene
doing a
said,
little
didn't
interview.
you know, didn't your wife or didn't you